As someone who lived with a chronic illness, can you talk about the ways in which the healthcare system is failing you now as a patient as we navigate this difficult time?
It would just be really helpful, I guess, to have my health or healthcare in general and my healthcare team just to be more available in different ways, like telemedicine or checking up on online now because we can't do it in person. And I think thinking about ways that if I did have to go in person, that there's certain measures that they're taking and thinking about. So like maybe taking me to like a different room that's not been touched by 1,000 people, or having a whole separate building maybe during this time that's like, okay, we're taking people who are easily susceptible to things over here. Also just regularly checking up on me would be helpful. I haven't heard from any of the healthcare team at all, and I just had surgery about 14 days ago, and so that to me is concerning. Yeah, I feel like we have so many capabilities to connect, and yet the healthcare system pretty much for me has been very behind in that way. And I feel like kind of just a number or just a another person to treat instead of someone that they care about and want to make sure that, especially within this time, I'm okay. And if I'm not okay, is there something that could be done? Like, even just asking that during this time would be entirely so helpful and
How are
supportive.
you coping now that we're living in a time where we are restricted from going outside? How are you coping with that?
What's interesting about this time, this time that we're in this pandemic, is that in some ways I feel more prepared than most, um, because I have, in some strange way, for the last 8 months, I've been bedridden in the house, quarantined, um, and psychologically, I feel like I've worked through a lot to be able to be in a place where now even my partner and other people around are kind of freaking out and going like, what do we, how do we do this? Like, what do we do? And I'm like, oh, I have all the tools for this. Like, I've been doing this for 8 months, you know? And at the same time, because we're in such an intense time, and because we're in such a big lockdown where we actually can't even leave our neighborhood at this point, I'm worried. I'm concerned because I've been in and out of the hospital for the last 7 months, from flares and from dehydration attacks and things that happen to me that I can't control, that I need hospital intervention for, I need IV fluids for. I need to go to my regular doctor often. There's just so many things that if something happens within this time frame that we're in and I need medical care, I'm really scared, because the last place that I want to be is a place where there's a possible potential for me to get this virus. Um, and I think what I'd like most people to understand too is that my immune system is really weakened from this chronic illness. And so even just getting a common cold or a virus is debilitating. And every time that I've gotten a cold or a virus, I'm immediately having to go to the emergency room to get help, because my body has an overreaction to what's going on top of my symptoms. So this time right now is really scary. I'm trying to get all the resources that I need on a regular basis mailed to me from complete strangers who are so kind and loving. But I'm honestly relying on the support of strangers and community members and my GoFundMe to be able to even have the financial resources to get the care I need, and the supplies that I need that I would normally have someone go out for, or a caregiver help with, that can't even enter my home anymore. So that part feels like really scary for me.
What would be your advice to the general public about the quarantine and the restrictions around having to observe social distancing rules?
My biggest advice for people to cope with this time that we're in is I think number one, just stay really calm. Find ways that ground you. For me, it's meditating, waking up, not checking my news feed right away, which has been really hard. Connecting if I'm with another person, like my partner, I'm lucky to have in the house with me. So taking a moment to really drop in and being able to be human for a moment together. Um, and also it like allowing whatever is coming through to come through. There's going to be a lot of grief, there's going to be a lot of frustration and anger and upset and tears, and then there's going to be days where it's like, oh, this is a vacation and it's so much fun and I can sew and like make a scarf or something. But it's going to go up and down, and it's totally okay to oscillate and to be between so many different emotions, and to be with them and fully express them. And I would say, in a practical way, take care of yourself. Make sure you're drinking enough water every day, that you're having your meals like you normally would, and that you're doing things for yourself that feel really good and grounding. And yeah, I think it's not easy, it's really hard. But I think there's a level of acceptance that I've had with this and living this way that has made me less anxious and less like I'm missing out on something in the world. And especially now, because everyone is actually doing what I'm doing, for the first time. And I think we're all in this together. And yeah, I would say that just also reach out to your community who is online, because there are so many people now and so many businesses and support groups that actually like weren't even available a week ago, that are now online offering free counseling support, and a lot of other things. So yeah, that would be my advice for this time that I've learned it, at least.
We're so honored to have you, and we look forward to amplifying your voice.